Known as a great imitator, Lyme disease has been deemed as an epidemic. Joining us with more on this growing threat is Dr. J.P. Saleeby, Medical Director for Carolina Holistic Medicine. Dr. Saleeby, thank you for joining me today. And this hits a little close to home. I know someone that went through Lyme disease. How common is this really?
Well, it's pretty common, more so than the general public thinks. It's in an epidemic sort of situation for many years now, and there are a lot of Lyme advocates trying to bring it to people's attention. There's movies, documentaries been made, international organization. So the British Medical Journal published a paper about 2 years ago where they did an analysis of European and Asian people and then extrapolated the data to basically come up with a number of about 14% of the world's population having antibodies to Lyme, so they've been exposed to the Lyme disease. The tests they did after I reviewed the article, the testing they used was really inadequate, so you could probably double that.
So it's worldwide.
It's worldwide, every continent.
Increasing. What do you think is contributing to the growing number of Lyme disease infections? Well,
migratory birds will spread it. The little tiny nymphs will hop on the back of birds and they'll transmit it all over the world. It can also be transmitted by ticks, and we think fleas and possibly mosquitoes. There's a chance of sexual transmission as well, and congenital Lyme, where it goes through the placenta from mom to baby. So there's several ways of transmission. But the global warming situation, the climate change, if you will, ticks and mosquitoes are on the rise, and those are the vectors that transmit.
Yeah, and I think one of the most interesting things is that the symptoms present differently in everybody. Can you speak on that a little bit?
Yeah, so it's the great imitator or masquerader. So never ceases to amaze me the kind of presentations that people come in with. Everything from the arthritis, the Lyme arthritis, to myocarditis, rhythm problems, imbalances in hormones, rashes, regional pain, migratory pain syndromes. And it's not just Borrelia burgdorferi, which is the agent that causes, it's the spirochete that causes Lyme, but there's a host of other infections that you can get from a tick bite.
And now, can people have Lyme disease and not even know?
Absolutely. They can go many years without any manifestation, and then something may trigger it. Let's say another illness or some kind of stress in their life can make it manifest, and all of a sudden they think, well, did I get bit by a tick last week? No, it was maybe 5 years ago or 2 decades ago.
Yeah. And there's quite a few antibiotics that are commonly used to treat this, but I feel like botanicals are kind of coming to the forefront and some other treatment options. Can you speak to those?
Yeah, so there's a select few antimicrobials that are used to treat the tick-borne infections. That's the ones I just mentioned. Doxycycline and cephalosporins come to mind initially, but things like Plaquenil and some antiparasitics are used. There seems to be a high failure rate, and they have to be given for long periods of time. So somebody might be on 2-3 months of antibiotics, even IV antibiotics, and then they'll relapse months later. So the botanicals are safer, there's less collateral damage, you don't get dysbiosis or disruption of the gut microbiome with botanicals, and there's a large selection to choose from.
And now, you mentioned a documentary earlier. What documentary are you talking about?
So there's several. About 2 decades ago, there was one called Under Our Skin. There's part 1 and part 2, but most recently, within the last couple of years, The Quiet Epidemic is a newer documentary that showcases a particular person who had a really bad case.
Wow. Well, that is a place where people can watch and learn more, and they can also visit carolinaholisticmedicine.com for more information. Wonderful. Dr. Saleeby, always a pleasure.
Thank you.
We're back after this.